because they are that those ingredients are often still in the mix despite the chronic health sort of picture. And for some people that's not the case. I mean, for some people you might have, been diagnosed with ME or fibromyalgia, something like that, and then your whole life has changed on the back of it, and you're working really hard on diet. Maybe you've worked with a nutritionist, but you are still experiencing symptoms. And or maybe you just have never linked the two, which that's totally not your fault. That's absolutely how society, what it wants us to not connect the two. Like the medical world doesn't really connect the two, so we look at things very differently in the work that we do. So very often those issues are still in the mix, and so we like to use this analogy of this iceberg, that on the top of the iceberg, the bits that you can see are the poor sleep, the skin issues, the PCOS, or the headaches and migraines, like all these sort of issues. But underneath it, maybe low protein, gut permeability, food intolerances, insulin resistance, sluggish liver, histamine intolerance, ultra processed foods, progesterone deficiency, leptin resistance, cortisol resistance, estrogen dominance, and all of that, with the chronic inflammation picture is what leads to those issues. So we are so interested in getting into, I'm going to go back to the ingredients that are making up your cake, and seeing what needs to be changed out. Because the other thing is, even if you have been working with a dietitian or a nutritionist, Laura and I both trained as nutritionists, and it was probably one of the most heartbreaking days of my career where I realized that 99% of what I'd been taught was incorrect. I can
Hmm.
honestly promise you that I work with people on a weekly basis where I see their health history form, and I have got alarm bells going off about some of the foods that they are eating. And then when I speak to them, I find out that they've been working with a very expensive nutritionist. Nutritionists don't focus on food intolerances. That's not something that a nutritionist is actually really taught how to work with. That comes from our work as kinesiologists, where it's a really big focus. So we've been able to tie the two together. Nutritionists also don't really focus on blood sugar balancing, believe it or not. They look at the overall protein amount in a food. They don't look at the hormone response when we eat foods. So we are looking at diet in a very different way. And people always say to me, well, what's a healthy diet? And I said, what is it you want to achieve? Because if you're just looking for a macronutrient balance, then sure, your porridge in the morning is probably fine. If you're looking for blood sugar balancing because you want to get rid of some of these issues that are at the top of your iceberg, we've got to pimp out that protein, that porridge with protein. So we're looking at conditions. We're looking at food and diet and lifestyle from truly the perspective of dealing with these hormonal imbalances to change what's at the tip of this iceberg.